Okay, good afternoon, everybody. Today is the Board of County Commissioners work session, Tuesday, January 14th. We have a presentation right now on census and then legislative update after that from Kara. So Kara, take it away.
Thank you. So Kara Silbernagel in the manager's office, and as you know, Pitkin County has been supporting trying to build up a local complete count committee since last year, and we have great participation. We've got representation from jurisdictions from here to Parachute, all the counties and municipalities, and we are moving into January. We're 77 days away from the census, and so all the jurisdictions are doing a presentation this week, and next week is kind of the launch of this local outreach effort, and we wanted to do that presentation with you guys here to see what the local effort is going to be. So why the census? Your census count is as important as your vote. It is constitutionally required of all people living in the U.S., regardless of citizenship. And why it matters. funding, the best estimate we've seen so far that are kind of being used nationally is that every person represents $2,300 annually that comes to your community, and that's through local funding for roads, schools, education. It's in a variety of ways, but it's important. This year, kind of as was alluded to initially and in the newspaper, that Colorado's population is growing, and we are poised, if we do get a count of of what is estimated right now, to potentially gain a seat in the U.S. House of Representatives, and that it drives a lot of important decisions for community development based on those population numbers and income and what kind of comes out of that decennial count.
Another question,
Mm-hmm.
Tara. So, if Colorado was able to gain a seat in the U.S. House of Representatives, that would most likely be in an area that's grown tremendously in population.
If Colorado gains, thank you for that. So in addition to gaining a seat, it will also then result in redistricting. So it is across the state, and then instead of, I should know this number, 9, 7, however many we have today, there will be an entire process of redistricting across the state of how that number is split up.
Oh, and that could include our district?
So it would likely include our district, and in actuality, there's also a good chance, even if we don't gain a seat, that redistricting and how those district lines are drawn will also could potentially change.
Yeah, that's interesting, because our district is probably one of the largest and most diverse districts in the state.
Mm-hmm.
So it would certainly help us in Pickens County with better representation.
Right,
Yeah.
absolutely.
Yeah, we could, depending on it's all a numbers game. They're splitting the House districts equally
Right.
by population. So the 3rd Congressional District could potentially get larger geographically if the bulk of the population gain was along the Front Range.
Well, it's all in numbers. So if you've got 100 people and you have to have 10 districts, every district has to have 10 people. So if we're undercounted, then our region will stay really large. If we get a count and are experiencing that growth, then our region could potentially shrink, because smaller geographic means more people in it and changes how your representation.
And if we get an 8th Congressional District, the size of the 3rd District might actually be smaller geographically, because they probably would take some of our population and put it in the new district or something like that.
Absolutely.
Yeah.
And just a quick note, the representation in the House is also whatever we gain means another state loses. So that's why you're seeing the state of California is spending millions of dollars, because their loss is another state's gain. And so unfortunately it is somewhat of a competition game across other states and not a collective, everyone counted. So that's why it's important that we count here in Colorado. So in addition to general getting everyone counted, there's additional challenges for the 2020 census. As was shared earlier, and I think has been shared, is that the funding and the ramp up for the funding for 2020 is much more limited than it was in 2010. Just the number of U.S. Census Bureau workers that can be hired, the job market in general makes it more difficult. And this year is the first year that the census form will be online, which has actually added a lot of complexity to the process. So it's not even just filling out the form online, it's who receives the invitation to complete the census, how the invitation is being delivered, what is even included in the invitation, and I'll walk through these in a little bit more detail, and then how and when you actually complete that form. And so this is really where our local efforts are focusing. So this is a rough map. It's from the U.S. Census, but nationally, 95% of household units will receive an invitation to complete the census form online. That's the purple in the map. So obviously, 95% of Colorado is not receiving that form. Compounding that, the dark purple, which there's only a couple, are actually the only places that will receive a bilingual form initially. Otherwise, it's only just in English. And the green areas are the only ones that will receive an opportunity up front to complete paper form on the first knock. So essentially, and then the white areas are places that actually won't even receive an invitation because in the mail because they don't have a mailbox. So what that means for us here locally is a lot of our bilingual constituents will not receive information bilingual up front from the U.S. Census, and many areas will actually receive something hand-delivered on their door. So that's what these beige areas represent, is that there's not a PO mail, that they typically have a PO mailbox. And so forms won't be delivered to PO boxes, they will only be delivered to physical addresses. So all these beige areas are actually going to be hand-delivered on a doorknob. So a lot of complexity of how you even get that information, and that's what a lot of this local effort is, to be able to know that look out because you might have people knocking on your door if you're in a gated community, and so forth.
So on the ground here in Pitkin County, anyone who lives in Snowmass Village will only receive the census form at their home on their door.
Correct.
Okay.
Correct. So these are, what happens here in Colorado is very different than kind of the national standard, and so that's why we're really focusing on some of these complexities that I think at a higher level are somewhat not as big of an issue.
But if you have a PO box, wouldn't you get delivered in a PO box?
She's saying they're not delivering to PO boxes,
I
only
missed
to
that.
home residential mailing
Yeah.
addresses.
Oh, okay.
Yeah, so you will not, if you receive a PO box, you will not receive the census form invitation.
No. So it's not just Snowmass Village. I mean, I've got a
Right.
PO box in Basalt, for
Sure.
example. And
So if you look at
I'm just saying, because nowhere in Snowmass Village has residential mail delivery. You have to have a PO box in Snowmass Village. So for
yeah,
just
and so you
on the
can
ground
see
there, yeah.
on this map, the bulk of Pitkin County will not receive the invitation in the mailbox. So this is where we're focusing our efforts. So that's a lot of what is an issue here locally. And then just in general, we talk about hard to count populations. So there's the hard to contact, right? Such as physical access, gated communities, PO boxes. There's hard to locate where those, especially in complexes where there's multiple buildings, how do we find those? Obviously hard to interview, language barriers, low literacy rates, internet access, and then there still is just civic engagement and convincing people that the census is important and safe. And so those are really the parts that this local effort is looking at, is how do we focus on these hard to count populations, which really includes everyone, but we have targeted efforts. Then the other piece that is difficult this year is the timeline and trying to easily communicate it. So April 1st has always been Census Day, and that's what you count. However, because the form is online, you can actually start filling out the census beginning on March 12th, but Census Day is April 1st. And then after April 1st, if you haven't completed the form, then the door knockers start to come, and I think there'll be 5 rounds of door knocking until the form is completed, or they will stop. So also trying to get these dates communicated out to our community is really important. And so we've created the Aspen to Parachute Complete Count Committee. Like I mentioned, it's a cross-sector coalition of local governments from Aspen, Pitkin County, down to Garfield County, town of Parachute, town of Sill, and everywhere in between, as well as a blast of nonprofits and business partners to really partake in this endeavor. So try and get the importance of why it matters. And the goal of this Aspen to Parachute Complete Count campaign is really to ensure every person in our region is counted, and that we target outreach efforts to meet the hard to count populations in our community. And for that specifically, where we've highlighted is there's young children, so 5th grade and under, seniors, seasonal workers, obviously households without mailboxes, and the LatinaKx community are where we're focusing. And part of this is getting into that civic engagement, is also to really focus on messages that can address those concerns, engender trust, mitigate the fears, explain why it is important and what it means for this community, and answer the questions that might come up, the who, what, when, and how to complete it. So in general, this is the general message, why complete it. It's important, it's easy, there's only 10 questions in 10 minutes, where you live, who's living with you, and some just basic socioeconomic questions. That it is safe, the Constitution guarantees your answers can't be used against you by any other government agency, and that it's not personal. There's no social security numbers, personal identifiers, or most importantly, citizen questions on it.
So Kara, the census, they used to have like one in every 6 or 7 would be a long form questionnaire that asked all these questions about, do you have a refrigerator? How many flush toilets do you have?
Right.
Specific invasive kind of questions about what it's like inside your house. I hope those are completely gone. It looks like everybody gets the 10 easy questions. To get the basic information, we want to count number of living quarters and number of people, basically.
Correct. The long form is gone, and now the American Community Survey, which is what the long form fed, actually does intermediary. Essentially, it's not the right word, sends out essentially the equivalent of the long form throughout the various tenures to randomly selected households. So the long form is no longer part of the 10-year count, and everyone will get the 10 question survey.
Okay, I think that will make it easier to get a good count. Because people were balking at doing the long form.
Absolutely.
Yeah.
Okay. So what we're doing locally, we're looking at advertisements. We're working with the local media. RAFTA is committed to providing us bus space throughout the season. Trying to get kind of some grassroots video campaign, why the census matters to you. What we are doing is some inserts in utility bills, grocery stores, where is everyone going to be, and how can we reach them and talk to them just why the census is important and what it means here. And then what we've done is really targeted the hard to count populations. So I think this is really creative, that working with 5th grade and under, and especially in RE1, we're still trying to connect with RE2 and Aspen, but we have census coloring sheets and word puzzles, and everyone's going to do a Census Crew lesson and distribute materials on Census Day. We found that actually that kindergarten age, or sorry, not kindergarten, that elementary school age is actually some of the most important that can reach to parents and provide that education, especially in English as a second language households. And then for the LatinaKx Partnership, we've actually done a focus group with some various communities and partners up and down the valley, and so this came out of that effort, is again working with the local organizations, sharing on their social platforms, providing information to the libraries in their after-school programs, providing a mobile computer station that can be filled out and provided at different community events, and again, kind of using a speaker series at the Latino Chamber, and Club Britano and other outlets that way to find that, really try and build that trust amongst those that in the community. And then senior citizens, I think there's some creative things that are coming up, which is producing large print information sheets, but I guess also there's talks about utilizing a singer-guitarist to do some of the different senior activity lunches and a musical presentation and talk about the census, and also how to fill the form out online, because we think that's one of the bigger barriers with this population. Working with Health and Human Services throughout all the counties to help spread the word there, and again, using the libraries as one of our biggest champions. For the seasonal workers, it's working with SkiCo to help them promote within their HR department. So how they can reach all of their seasonal workers, email messages, events, working with temp agencies, and then also through building permit packages to reach out to the different contractors that might have some of the seasonal workers there or temp workers, and getting the business owners to also be a champion and understand why it matters to them to make sure their employees participate. And then the no mailboxes, we have people that are trying to work with the post office, which is fantastic, is to provide inserts into all the PO boxes, Aspen to Parachute, which will help communicate that they are not going to receive anything in the mail and that they'll receive it on their house, and kind of the dates of when that can be. People can expect to see that on their doorstep. And also doing some follow-up in areas of low response rates. And then in general, just trying to see everyone, including electeds up and down, and all of the employees of Pitkin County and others, that we're all advocates for this. And so providing a 101 basic, how do you speak about it whenever you're talking to your friends or colleagues or people that walk in the door, to stress why this matters on a large scale. And so most importantly, I think just thank you for the support. This is really kind of shows a regional approach and why it's important for everyone that's participating in helping feed this effort. And I want to also commend Aspen Community Foundation has stepped up and is being the fiscal agent for this process. So there's not one government entity trying to lead it. That Aspen Community Foundation has stepped up to lead this regional effort. So how you can help: number one, complete the 2020 census. Talk about it, talk about why it's important, tell your friends, your family, your neighbors, your colleagues, and then write a letter about why it's important, why you want to participate, and how it's impacted your life and your community. And with that, that's the census.
Kelly's.
So I have a question about what the outreach committee is allowed and not allowed to do. For example, instead of putting a flyer into post office boxes that says, look for this on your door, can the outreach committee say, this is the information to conduct the census, go complete the census?
Yes. So great question. So they can do all the above, and we're looking at both. The one thing the local effort cannot do is we can provide the laptop and the electronic device for people to fill out the form, but it's kind of like voting. We cannot be there or help walk people through filling out the form. That has to be kind of like a voting booth and completely independent. Otherwise, basically walking, for a better, lack of a better kind of analogy, is walking someone up to the computer and helping them even identify what their code is. We can help with that.
So you couldn't bring the 10 questions, have someone fill them out, and then data enter them later?
No, we are not allowed to do that.
Are there any other kind of considerations for if someone gets a knock on their door, how to identify an appropriate contact versus a fraudulent contact?
Yeah. So anyone that gets a knock on the door is going to be a U.S. Census worker. That's the official knock on the door. They will not be uniformed, but they will be badged. So if you have any questions, I know that there's already been some, at least nationally, concerns about scammers out there. You can always ask someone knocking on your door for their badge, and every official U.S. Census worker will be badged, but they will not be in uniform.
Okay, so these partner groups are not doing the door-to-door
Correct.
outreach?
Correct. The most that we'll be doing is, we believe we'll be able to get some close to real-time data of who has filled out, and so we could maybe do targeted outreach efforts in a housing complex, for example, or something like that, but we would not be doing official door knocking.
Okay, thanks.
Mm-hmm. Great question.
I would anticipate, I worked at the 1990 census, so I was real familiar with the process then. But I think with this computerized and the mail-in system, that I think the Census Bureau already has a list of all the physical addresses that people live at or potentially could live at. So some of them are empty houses, others have real people living there. And what they probably will do is go around to the places that do not respond and knock on the door at those. So the easiest thing for people to do is to fill out on the computer or the mail-in thing, get the thing done, and then you guarantee that nobody's going to be coming to your door knocking because they'll already know that your household responded.
That's a great point, and that's what our regional rep for the U.S. Census said. He said the number one thing is if people are fearful and don't want door knockers, fill out the form and then you won't have any door knockers. So.
Then also thinking of some of the unusual cases in 1990 in Pickens County that could potentially still be the same. There were people living, ski company employees sometimes living in odd places like maintenance things way up on the mountain that have no physical address. They're not a dwelling unit. They have like a bunk room in there that people actually live, odd places on the mountain. Hotels the same way. They'll have employees sometimes living at hotels where you don't think there's anybody living there, but I think checking with businesses to kind of search out for those kind of people living in odd places that might not, they'll never have anything hung on their doorknob because it's not officially a house, is important. Then the other one that caught us by surprise was the people living at Grizzly Reservoir.
Oh.
It was totally, they voluntarily went over to Buena Vista and then contacted the Census Bureau and said, we haven't been contacted. But they do live in Pickens County, and I don't know how we reach them unless it's through if they do fill the thing out online or something.
Those are great points that I can't say are common things that come up for nationally of tunnel lake dwellers. But good points, and that is something that as it gets closer, we'll get more specific language of what it means when you fill out the form. So for example, if you have an ADU or something, maybe not as specific for Pickens County, but others, or if you have rental, just who actually counts in your household, that it's not just direct relatives. And so maybe some of that targeted could also be, do you have other facilities where people might be living? So.
I had a question just about the focus on 5-year-olds, or 5th graders or 5-year-olds. Which was it? 5-year-old? 3 to 5 year old?
It's bull. It's bull.
Right. So it looks like you've got kid materials. I'm just going to say, I don't know if it's if there's a format. Are the designs and everything handed down from the state or federal, or are we coming up with our own, materials? How does that work?
So we had applied for a state grant and did not get it. I think there was $16 million in request for $3 million. What that actually means, I think, is actually good for us because then we're not as beholden to state design guidelines. So we're actually, we have a graphic designer that's working on coming up with a design, and the state is providing input because they have some other designs, but we can actually have some creativity in it, which is good.
I was just going to say, the clarity, these really short catchphrases, as long as it's really clear to the point so people understand it. Sometimes I see really opaque. I was just, think of the signs, people, when they make a sign to be in a protest march or something, sometimes the signs are completely incomprehensible.
Right.
So if it's going to be a brief little message, a sticker or something, let's make sure that it really makes sense, whoever is making those calls.
Yeah, and thank you. So we have, on that note, we have also created our own census website, and part of that is because the census information and even the state information is overwhelming, so we wanted to provide a place people could go and just get to the quick information and be a little bit more user-friendly, but we'll still point people exactly to how they can fill out the form and other resources, but as a way to synthesize it a little bit more clearly, because it is complex and overwhelming some of the other information that's out there.
Are elected officials getting personally involved in this organization, or is it mostly staff-driven?
Right now, it's been at the staff level, but we're hoping that maybe as it gets closer to bring a collective elected official letter that can be sent out, or even some of those grassroots campaigns to say why various electeds see it's important, as well as a 5th grader and a 5-year-old, and kind of voices from all over.
Right, great.
And I'll just note, I mean, the timing for this is fairly advantageous for Colorado, since we have 3 elections this year. This happened to fall in a window, April and May, where we don't have an active election season quite yet. So hopefully this outreach will be more meaningful and not get drowned out with a lot of other door knockers for other purposes.
Thank you. And the real specificity is we're trying to hold off until after Super Tuesday, because we don't want to get buried in all of that. So thank you. Anything else?
Keep us in the loop.
All right. Thank
Thank
you,
you.
Kara. Appreciate you being involved and keeping us informed.
And it's all because of the support you guys have had. So, all right.
So, moving on to the legislative update discussion,
Okay.
which the legislators in Denver are hard at work already, and I understand there are already over 200 bills have been introduced.
And we have a team that is helping us manage it.
That's good.
So I will get started, but please, everyone chime in. This is a team effort with everyone at the table right now.
I think you're gonna do the talking, right?
Initially. So Karen with Public Health and Nan with Human Services, I'm also bringing up to help with this effort. So I'll walk through and we'll just see how it goes. And part of this presentation is to try and see, is there a way for 2020, knowing how crazy it is, that we as staff can help support the board in making the voice and the policy priorities that you guys have, and also where the gaps that might not be coming through the associations, particularly kind of with human services and public health, to help provide additional bullet points for you guys to advocate on. So here's what we've proposed, what we've thought through for 2020 of how to do this. And in the past, what we've said is, what are the associations that Pitkin County is a member of? And then how do we look at their policy priorities? And then say, where does it apply to Pitkin County? Where is their alignment? Where is their conflict? And then maybe where is their conflict between associations? And then from there, what are the gaps? What do we know are the subject areas that are of specific concern for Pitkin County that might not be covered by some of these the associations that we're more active in? And how can we track that? What are the common areas, and what are the partnerships and coalitions that we can build upon? So this is just a glimpse. As Steve said, it was outdated before I was finished building the table, I'm sure. And this is only the legislative priority issues for CCI, but as we were going through, it's what we know today. Obviously, the business license authority was Pitkin County's priority, and so supporting and advocating, and we'll see when that comes up. The 811 exemption, I know Road and Bridge and Public Works are following that closely and are recommending to support that, as the 811 rewrite that happened last year has caused additional confusion. I know Nan is probably going to talk about this a little bit more, but also the fostering community engagement and understanding the behavioral health system, which is the transparency bill for, what do MSOs?
For behavioral health.
For behavioral health, okay. Is monitoring, and we're trying to reach out to the partners there. And if you guys have input, please, we can change any of these. And I know initially the enhancing public safety funding, there's some initial concerns from the sheriff's office, so we're trying to stay in line with them as that might move forward and what the feedback might be. And then increasing the permit fee caps for on-site wastewater, Pitkin County has been supportive of.
And repeal. the fee
Repeal.
caps.
Oh, thank you.
Yeah.
That's a better way to say it.
So on the traffic infraction fines, I would also coordinate with the DA's office.
Okay, great point.
Because it was actually the Montrose DA who brought that forward. That started the ball rolling on that bill.
Well, and it's quite possible those will conflict.
Yeah.
Our sheriff and the DA
Right.
recommendations.
So we'll keep talking about that one, obviously.
I just, for the behavioral health transparency, I don't think it's the MSO, because that's the RAY. I think that we would be reaching out to our providers, because I understand they're the ones who are opposed, and they're the ones to whom this legislation is directed, right? It's about their overhead costs and their outcomes and that kind of stuff. So I think I would just change that language to mental health partners.
Okay.
And I don't know how detailed you want this conversation to go. I guess I'm looking to Kara.
I don't know either.
Okay, because I just, man, it would help us, and if we don't have to have this now, but maybe an offline conversation, just to sort of understand some of the feeling that I'm getting around the conversation with the MSOs is that there's a feeling that there are resources that are kind of being hoarded and unaccounted for, and that the advocates for this bill are trying to like crack that open a little bit and shine more light on where resources are going. So I just, it would help to understand if you see that as an actual problem, or if our providers are already doing a really good job and that transparency lens isn't as necessary.
I'll share some ideas and see if Karen does. It's not the MSO. So the MSO is the managed service organization that manages the funding. So that's the RAY. It's the community mental health centers and their providers. The issue came up, and Steve and I were in a meeting at CCI where some of the West Slope were particularly frustrated with what they considered to be hidden costs and expenses with the community mental health centers. They got a lot of engagement and energy from Mesa County, so we all use the same community mental health center, Mine Springs. And then it gained traction in some of the southeast and the northeast areas, so it's really, my understanding is the origins of it were about the cost of community mental health, where the HCPF, the Medicaid dollars, and where the Office of Behavioral Health dollars are going, how much is going to bureaucracy, how much is going to services, and there's a request or a demand originally for what I would call a fiscal forensic, right? They want some legislature that's gonna call for audits, some financial audits. I heard today on a call that there was a meeting in Denver last week, mostly attended by providers who are pushing back really hard on this, saying that they get audited all over the place and this is not necessary. So I think that from my position, we've done a lot of this work with Mine Springs. When we did our RFP, we dug really deep underneath their hood and we looked at everything and we negotiated some prices. But I think we would want to monitor this to see if there's an uncovering of understanding that would align to the real needs, which is how are we providing mental health services in the state.
Okay, thank
Do
you.
you think,
That was perfect.
do you want to add anything? Because you were.
And
Steve
at
was there.
CCI,
Yeah.
at CCI, because it is a CCI-supported bill, CCI is not gonna change, very unlikely would change from a support position on it,
Yeah.
because it's already a CCI bill, even though we might rather have a monitor position on it.
Yeah, and when I mean us monitor, it's sort of look for the opportunities to voice anything that would be appropriate or
And
could,
there might be amendments we could support.
Correct.
That would make it better.
yes,
Yeah.
yeah.
Okay, thank you.
So obviously CCI will tracks and participates in a lot more, and we'll be tracking that. But for kind of kicking off this session, then we looked at other priorities. So CCAT's priorities kind of cover the affordable housing, healthcare, some of the human services pieces, transportation, and a little bit of fiscal reform. It seems a lot of these are aligned with where Pitkin County is. I'm going to let Nan, I don't know if there's a piece on human services you want to touch on.
Yeah, I'm super interested in affordable housing from a human services and public health standpoint. We're both interested in that. As well, the public option and reinsurance impacts both human services and public health. So the child welfare staffing, Robin Smart has been very active in creating a plan to take what is known as Senate Bill 242 dollars. That's we get $60,000 for one child welfare position, our supervisor, from that. And it came from a workload study that said we were seriously understaffed statewide. So she wants to combine the Senate Bill 242 dollars into the child welfare block. And I think primarily for ease of management, but I'm not sure. And then in doing that, she's proposing to reduce the county share from 20% to 18%. Remember, for child welfare, for much of it, it's an 80-20 split. For us and for many large counties, and most of the counties that get Senate Bill 242 dollars, this is super threatening. I looked at models, and I have a draft of a model she presented to the JBC today. If they do this and they blend child welfare staffing with the block that has a certain formula for funding us, we would lose $42,000. The position brings us $60,000. So the benefit to us and to the large counties is if we keep them separate, it's protected from any allocation formula changes in the block. Mm-hmm. The bigger counties are concerned because they've never received all the positions that they were told they needed. So if you start blending it into the block, you completely obfuscate the goal of adding the casework staffing. So I think that one's really important. The CCAT goals on trails and CBMS are really about the functionality of modernization and the move toward interoperability. Mm-hmm. And we'll just keep watching that.
And I will just note for CCAT, my understanding on the human services bills is CCAT isn't in like kind of the lead role on this advocacy, but is working with partner organizations to support that advocacy. And then on affordable housing, in addition to continuing to go after funding, some of the other things that they're looking at is possibly reformulating the state housing board or advocating for kind of a larger formulation of a statewide housing council to provide direction on how the $170 million over the next 3 years should be spent.
Particularly rural and frontier.
Right, mm-hmm. And there's not a lot of appetite from Governor Polis to create new government entities, so looking at reformulating and expanding the purpose of the state housing board might be the opportunity to do that. And then short-term rental work should fall somewhere on this list as well.
It would be really important for us to stay connected on the CCAT priorities because I didn't know what they were until Kara sent them to me yesterday. Sure. And since I'm now going to be on legislative calls with CHSDA, I have in the past gotten stuck in the middle between CCAT and CCI. Sure. And that's a really uncomfortable place. So we'll do a better job. We need to stay close on what's going on with CCAT so I don't step out there.
CCAT will be having Zoom video. They're using Zoom video this year, which I ran afoul of that yesterday, trying to navigate my way. But it's Thursday at 3:30 to 5. They're having a Zoom video. So that'll be our first opportunity to hear what bills have been introduced along these priority
Well,
lines.
with CCI, we have joint meetings, like directors can go to CCI HHS meetings, so we know where commissioners stand. But so it'll be good to learn about how CCAT's working, and because I don't have a sense that my peers are connected to CCAT either, and so that feels like a risk, only in terms of being more effective.
And with that, I would love to get your thoughts briefly on where CCAT is looking at around the public option, knowing that it's probably one of the most, I would say, almost contentious things coming in front of the legislature this year. So who are they supporting? How is that happening?
I would say that our conversation in our fall retreat was a bit guarded. Interested in monitoring how the public option conversation takes place with an eye towards making sure it doesn't undermine the local cooperative approaches that the counties have been heavily vested in. And, ours with one cooperative approach, Summit County and others with their cooperative approach. So that's kind of the starting point on that. Again, we'll hear more this week.
Yeah, I think having a real clear connection with the BOCC in regard to that, so that we're staying in line with the local Valley Health Alliance and some of the things that are really innovative here that may look different in other communities, and so that we're messaging in the collective voice.
And I think talking to our local hospitals who are in the VHA is going to be important in that conversation.
And also including our FQHC partner, because the uninsured are not represented in the VHA, and that's a huge burden.
And I think just from a process standpoint, that's what we're trying to bring this session, is where you guys are having CCAT and saying, we really need to know what the hospital and the FQH is saying, that
Federally Qualified Health Center, Mountain Family.
That we can be more responsive to get you guys some of their feedback, what public health human services to bring back to those conversations with CCAT too. So making it a dialogue both ways.
We brought Shirley to the table.
Yes.
She's on our team.
Shirley's part of our team now
Legislation
too.
team.
Yeah.
Welcome, Shirley.
CC4CA, I'm not going to go over all these. I think we all know CC4CA has gotten a lot of capacity, I think, and is making strides, and which is fantastic. So from the staff perspective, is just trying to make sure all the other moving parts stay aligned in what's happening with CC4CA and some of the other initiatives, and where there's a place for us to speak up or provide additional resources of what might be particular here with Pitkin County. So these are kind of the bigger areas, and where they can be in alignment with other associations, obviously, as well. Others that we're following but are a little bit less, well, honestly, we didn't have time to look at them all, is Northwest COG. More importantly, I think Northwest COG QQ is more active. Colorado Communications Utility Alliance has really stepped up in some of the broadband and telecommunications role. And I did not get all the subcommittees, but I know there's a couple subcommittees in particular at Club 20 that have really been influential for us. So continuing to monitoring those and where they might be conflicting with other associations or Pitkin County priorities. So additional priorities for the county. So I'm going to hand this over to Nan, and I'm sure she even has some updates from today, but to let her talk about some of the priorities for human services.
So I sit on the Adult Protection Allocation Committee, the Adult and Aging CHSDA Committee, and the Adult and Aging Sub-PAC. So we're on top of the APS statute changes, and we'll just bring that to you as it comes up. It's really about due process for background checks, because you all remember that. When we have a finding of abuse of a vulnerable adult, we now have to report it to the courts, and there's it goes on people's backgrounds and they can't get work, and so there's still a lot of questions about that, given that we're not investigators, we're of sorts. Family First is going to be big, and we've been talking to you about that, about how is it funded, how does it work in trails, what are the rules going to be, what's the definition of candidacy. So Matt and I are involved in a lot of activities about this, and we'll keep bringing them. Childcare licensing standards seems to be an ongoing change, and Shirley and I can talk about that. A hot issue is the basic cash assistance, which you guys have heard. So Colorado Works, the TANF program, allows us to either support very low-income families with basic cash assistance, like a cash stipend every month through their EBT card, or we can give diversion payments. So we could help fix a car, or we could help someone take a class at CMC, or help with childcare or something. In Pitkin, we have 2 basic cash clients because no one qualifies, because it's, it would be impossible to live here. So all of our work is diversion. We have, and I have sort of historically taken a position that we're in favor of increasing basic cash assistance. But we can't do that unless there's a lot of focus on how the state's going to back that up with a fiscal note. They want to take the funding out of reserves, but that's not a new funding source, and it will get depleted because clearly in the Big 11, they have way more cases for basic cash assistance. So I think we'll have to keep watching that. I was telling Kara that while we're in favor of basic cash assistance, it's so egregious to the Big 11, and they're big partners of ours, that if it doesn't work for them, it surely does not work for us. So another solution will have to happen. I just want to clarify, so I was just reading this about the MSO, which is interesting because it is clearly about the managed service organization transparency and who they're giving funding to. And an example of that is West Slope CASA is our substance use MSO. And we've been asking them for years, where is their list of who they're funding? How do you get the funding? What's available? How do they make the decisions? Who's making the decisions? So I'm sure that's a big part of it. And Medicaid is just huge right now, in flux, trying to keep up with the changes in Family First and trying to address access issues. So that's the Child Welfare Medicaid entity. This one in particular, I thought was related to IDD, people with developmental disabilities. So prior to changes in the last year, there was one treatment center, a residential child care facility, RCCF, that provided inpatient treatment for seriously disabled children who have developmental disabilities and behavioral health issues. The way that Family First is changing in licensure, there are no more RCCFs in the state. And they're becoming something different. Can't remember the term. Qualified Residential Treatment, QRTPs, treatment programs. And so this is about, I think, making sure that there are services for high needs children. We would not oppose that.
And that might, I'm not sure if these are the same, but the conversation that I was listening into was a discussion about making one statewide RAE for children in the child welfare program who are on Medicaid. So if they move RAE boundaries, they don't have to qualify.
That makes sense.
That would be something we would need your input on, because we'll talk about that at CCI.
That's
Yeah, and I
interesting.
think,
Most of our kids go out of community, but we get them Medicaid and there's no issue. I mean, we haven't had.
Guess the problem is if you have children who are moving from a RAE boundary to a different RAE boundary, their,
They get disqualified and they have to reapply.
yeah. Or
And I-
reassessed or.
Yeah.
If I
all those
remember
things.
right, Weld County brought this forward, and I think maybe they are more carrying it instead of having
Yeah.
CCI have it a priority
I see.
bill, but still CCI's been involved in the discussions on it, and Weld County's putting their resources behind, because they've had a lot of cases where kids will move to a different ray, and it's created problems.
We, today on the legislative call with CHSDA, there are apparently several bills that Weld is putting forward, and generally they're pretty Weld specific. So
Yeah.
we'll watch those.
And with that, I'm also gonna hand it over to public health, and I'm gonna let Kurt take this seat.
Perfect. Okay, so this is the first one on the agenda is the bill that I think you're all fairly familiar with now, which is the nicotine product regulation bill. This is in essence a T21 bill at the state level. What is really powerful about this bill is that it permits retail licensing, or it doesn't permit it, mandates retail licensing. So it gets us back to sort of around the struggle we've had locally around retail licensing in House Bill 1033, which was a bit of a struggle this past year to really determine whether that bill really allowed counties to license or not. So we're in strong support of this bill from a public health standpoint, that this really does cross all the T's and dots all the I's and allows us to really have a uniform standard across the state of Colorado.
So how does that relate to the federal government
Yeah.
raising the age to 21?
Yeah, it's a great question, Steve. So there's been a little smattering of information that's come out from the Public Health Law Center around the federal tobacco 21 law. At this point, the federal law right now does not have the kind of penalties that even Pickens County has decided to enact. So I would say it's pretty watered down, beside the fact that it's T21, which is great, right? That's the good part of it. I would say that part of, with my wearing a very jaded hat, the tobacco industry still really pushed for tobacco 21 at the federal level. And I think in effect to really be able to say and to influence how that bill is going to play out, or bill, it's not a bill, how it's going to play out across the country. And so I would say we're still awaiting a lot of clarity around the federal tobacco 21 process. What is that going to look like? What is that going to look like from a federal regulation and compliance level? The state bill is much more solid as far as, Dora is going to be doing the compliance checks. There's some accountability around how this is all going to look at the state level. And so I would say at this point, the state bill is much more solid than what we're seeing out of the federal government. And again, we're still awaiting some clarity on that. I'm happy to share the public health law brief with you that starts to get at some of that clarity. Does that help answer the question?
Okay, yeah, definitely.
I just think as much as we want to, as close as we get to local control around this, the better it's going to be. We're still fearful that the federal bill will have PUP, or minor in possession, stipulations, which we've talked about in this room, why that is just not good public health practice. And so fearful to see that kind of thing maybe come up in the federal regulations.
Yeah, I'm sure there will be counties at CCI who say, well, the federal government's taking care of it. Let's keep the state out of it completely, and they would want to oppose any efforts in that direction.
Yeah. I think knowing our good local control philosophy in Colorado, this is a really good bill to have as close to where the action is as possible.
Okay.
With that, there's a number of opioid and other substance use disorder bills coming through, and as Kara mentioned and Nam mentioned, this is coming at us pretty fast. We just got the priority bill list from our CALFO, from Colorado Association of Local Public Health Officials, also our Colorado Department of Public, or CPAHA, our local public health association. Thank you. So this just came out. So we have a breakdown now of some of these bills, and I'm happy to go through them in detail. There is one that we're really actively supporting, and then a couple others that, from CALFO's perspective, that we're monitoring. But knowing that House Bill, let's see, it is House Bill 2010-85, which is the Prevention of Substance Use Disorders, Opioid and Other Substance Use Disorders Study Committee. We're supporting that bill, and then we're actively supporting. Kurt was just on this call. You probably remember faster than me.
Well, we didn't actually talk about the opioid stuff, so I don't.
Well, I think that's the only one we're actively supporting. The other ones we're monitoring or just supporting. And the actively supporting one, House Bill 2010-85, is really to cover the health insurance or provide coverage, financial coverage through insurance around non-pharmacological alternatives to opioids. So, for example, physical therapy or occupational therapy. So looking at alts to opioid treatment. So other things you can do to support pain management. And so this is really providing insurances, incentives to cover those kinds of alt treatment systems. And so we definitely are in support of that. Some of the funding will actually come through CDPHE, our local state health department, to local public health. It will also come through HCPF to do expert screening, which is screening, behavioral intervention, and referral and treatment program. It's like a substance use screening program that hospitals can do or local providers can do. And that also provides money for doing some education around prescribing itself for primary care doctors. So we are in support of that and think that that's one that would really help with opioids at the local level. Any thoughts, questions about any of those? Again, a lot of it just came out.
Just aside on the opioid issue, I keep every conference I've gone to where they're talking about opioids or marijuana, I ask, are there any studies that correlate, with the states that have allowed marijuana use? Does that affect the opioid use? And now there is a study that says the states that have medical marijuana have a reduced use of opioid prescriptions. And those that have recreational marijuana have an even greater reduction in the use of opioid prescriptions for pain relief. So that's what I was suspecting probably would be the case, but there wasn't any statistical studies done until this time.
I think I remember you asking that, so that's interesting that there has been a study since then.
Yeah.
And I think we just know just from the research around opioids that there are so many things that people can do that there have been actually a number of studies on, like, for example, yoga can be just as effective as using an opioid. And there's great studies out there on that. So really, there are a lot of alternatives to using opioids, and however we can get that into the public kind of knowledge base, I think is really important from a public health educational standpoint.
I don't know if you're going to cover the rest of the
Sure.
list. I'm curious if there's any legislative action surrounding vaccinations.
Yeah, so there isn't anything yet, Kelly, but we're anticipating. And we're anticipating on both, both ends. So there may be some bills that are coming up that will go back and look at the exemptions and what we can do around those, making them harder in essence to get. there is a push from, as you know, the governor's office to really look at increasing MMR rates with kindergartners, and what we can do around that minus legislative work. So how can we do other practices within our communities to increase those rates? So that may play out a little bit in the legislative realm. I'm not sure yet. And then we also know that there are probably going to be some anti-vaccine bills coming out this year as well. So I think just being kind of prepared to be
I
able
look forward to fighting those.
What's that?
I said I look forward to fighting
Yeah.
those.
So we're anticipating, and do you have an update on any of that? Sorry,
Yeah,
you
so,
know more than I.
We talked a little bit on the Council policy call this afternoon. I think the policy committee, we formed a subgroup on vaccinations and immunizations. And Dr. Levin, who's our medical officer with Board of Health, is participating, and Carlin Porter, who's our epidemiologist.
And Liz Stark.
And Liz Stark.
So we have three from Pitkin right now.
We have great representation.
Yeah.
They are discussing some, I believe it's still the bill hasn't been introduced, so they're still discussing some language with one of the senators. But they're looking at the exemptions. And I know that this is going back and forth because we discussed it today about not having public health sign off on those exemptions. So I think there'll be some really important discussions at the CALFA level on whether or not, I think right now it says doctors and nurses would be the ones that would be allowed to, and the idea is to make it more difficult to get the exemption, and whether or not public health needs to also be a partner in that too. So that was the important piece we were discussing today. So I expect you'll see something. I can't tell you exactly when, but I would think sooner rather than later on that.
Sure.
And I think Kurt hit on a good point that it's not necessarily removing exemptions, it's just making them harder to get.
Yeah.
Ideally, you know, the bill last year really removed the personal exemptions, and that's in a way helpful. It doesn't mean that you couldn't, you know, we want to support like medical exemptions and real tangible
sure.
reasons. But personal exemptions are just, they're easy, and they were really easy to get. And so yeah, I think it's a little bit of a compromise this year of making those exemptions harder, but not removing any of the three that we currently have in Colorado.
Okay.
Okay.
And then public health transformation, I just want you to be aware of it. We have been working, I think I presented in the budget presentation that we're looking at, we revised our core public health standards within the state of Colorado that got adopted by the State Board of Health. We're looking at leveraging a cost analysis that we did across the state to really say, this is what it costs to have an effective public health system in Colorado. This is where we're lacking in funds, and going to probably the JBC eventually to be asking for dollars. And so as we start to move forward with that and have better talking points and better ways of expressing what this is going to look like, I would love to have your support in some of that work, because right now we know that state health and public health in Colorado at the state from the general fund is vastly underfunded. It's 0.5 of the whole budget. And then we see that then articulate out into our local public health funding that we get from the state. We just don't get a lot. So that's still a work in progress, but wanted to bring that to your attention. I'll talk a little bit about we're just monitoring the Family Medical Leave Parental Support Act, right, in essence, and then Kurt can talk a little bit about all the environmental things.
So the CDPHE budget, with Senate Bill 181, we have a number of fronts where we're seeing regulatory changes. One at COGCC and rulemakings, and then same with State Health Department and their Air Quality Division around air quality issues with oil and gas. And I think the Senate Bill 181's on the next page, but I was just in a meeting with Laura Maker in the Attorney's Office and Ellen in Community Development, and Laura went ahead and applied for party status for the most recent rulemaking around Senate Bill 181 with wellhead protection, I believe is the title. But we also know that there's still the rulemaking around governance that has to do with local control that was promised as part of the Senate Bill 181. They initiated that and then they've delayed that now, so we're in kind of a hold pattern, but we know that we'll want to provide comment on that. So there's two pieces of 181 there that are still working on. They just finished regulations on flow lines. We didn't really get involved in that because we don't really have much here. That's a more of a front range issue, although we still monitor it. There are two bills that I just learned about today that are one has been introduced around water quality, and then there is a partner bill around air quality that both change the fines and criminal penalties around both of those. I think they increase with the water quality one specifically. It goes up to $25,000. I believe it's per day. So there's will be some discussion around changing those bills or those statutes with those bills. Back to the CCI piece, yesterday the OWTS bill was introduced. So it now has a number and it's been assigned to the local governance committee. I believe it's House Bill 1094.
House Bill 201094, you
Yeah.
got it, good job.
So, if you don't know, I'm really passionate about that one because we've been talking about that for probably 15 years now in terms of getting that changed. So, and then the other piece that really will come up this year a lot is going to be climate change bills and anything around climate change. CalFO is in the process of forming a climate change group that Karen and I both participate in. State Health Department has formed a climate change group under their air quality division. My understanding is they've completed the hiring process and now they're looking at it, but a lot of what that group will be doing will be looking at policy. And our climate change group in CalFO is looking to coordinate a lot with that State Health Department group. So as we learn more about their efforts, they have a kickoff meeting at the end of this week to really start to talk about what that department's going to do in their vision. I was happy to hear that they did hire somebody specifically to coordinate with locals within that group. So I'm expecting a lot of back and forth between State Health and our department on that. I think I'll just. You want to talk about childcare?
No,
I don't know.
On that point, I would just note that that would be another opportunity for us to ensure that we're aligned with CC4CA. So we're not missing wires on legislation.
And Kelly, are you or Greg, who's the representative? Okay.
Greg stays up to date.
Okay.
So, there isn't a great deal to say at this point yet about child care legislation at the state level. There have been some priorities identified, and a great deal of those line up with our priorities, particularly around the early childhood. Oh, I suppose I should. Around the early childhood workforce needs. So we're watching all of those. The Colorado Children's Campaign has regular conference calls as well as the alert that goes out that I pass on to all of you. And I think, it was exciting to hear the governor's State of the State address talk about education in general, talked about early childhood education, expansion of the Colorado preschool program, spaces. He also talked a great deal about health issues and everything else. So I think we're in for an exciting year. And otherwise, we have also talked among ourselves and hope to come back with some updates on local work before too long. So questions around the child care capacity or child care legislation?
I might rename this to early childhood education because I think it's going to be a broad swatch and we're going to want to watch most of it. And it's not just child care capacity.
Correct.
So just note to ourselves, team.
At the my aging meeting yesterday, the Strategic Action Planning Group on Aging, there was concern expressed by quite a few members there that the governor is putting so much emphasis on early childhood education, and he is seemingly intentionally neglecting the funding for aging population kind of initiatives. So
Huh.
that was an interesting perception, and the committee's fighting
Yeah.
back against it as much as possible, but
Yeah, I
that
don't
is
know what
some-
that tells us.
that is a dynamic that's happening in the state
It's not a
right
big
now.
enough pie.
There's going to be struggles between lots of different divisions because the pie is the same,
Yeah,
right?
yeah.
Competing
exactly.
needs.
So I would add, other coordination that we're looking at is working with Janice on some election stuff. It sounds like it should be pretty quiet this year, but in case there's any defensive mode that needs to be played. Working with Kathy, obviously, on some solid waste stuff that I think some of it should be coming through CC4CA, but if there's things that don't, there's typically some public land thing that comes through, and anything with broadband and 5G. But I think from this conversation, also adding, working with Chad and Senior Center and Aging, if there's things there based on the pie. So I know we're over. I just want to close a little bit and get some feedback from all of you. So what we're looking at this year is, instead of having these 15-minute updates every week with you all, is we've built this great team of everyone together, and Michaela in the back is helping us track everything too. And that ideally that we can work out as a team and work with the chair and vice chair this year, or whoever the BOCC representative is, and be able to be a little bit more flexible. So if there's statements that need to be made, or bullet points or letters, that we can work directly with chair and vice chair or other representatives to send that letter, and then we'll come back and tell you what happened. So we would still have like monthly updates to the board, or twice a month. I think initially start once a month, and if we need to ramp up towards the end of the session, but share what has been done, or if there's other things that would still need to have board, a board discussion on, but at least as what's been presented today, that we could take action working directly on these items, and then allowing everyone to be a little bit more proactive, and that if there's other things that come up, we can still have those discussions, but it wouldn't be kind of the laundry list every week anymore. So I just wanted to get if that seemed like an okay approach to give it a try, and we can always readjust as needed, but.
Yeah, and I think if we could have a good system for having our tracking list, whether we do it online or you can email it to us every week kind of a thing. We need to, Kelly and I especially need to be checking in every week throughout the whole legislative season.
Yeah. So Michaela has been using this first week as everything's been rolling to figure out what that system is. So this is a snapshot I borrowed from what she's been working on, but it will have what are the bills, and then there's also what do we know are the different associations and Pitkin counties, and then we can flip that out to the board once a week. And if you guys want to dive into it, you can. If you don't look at it, it's also not a problem, but we can use that as a mechanism, and again, start there and adjust as needed and provide feedback of what's working for you guys and what's not.
Okay. And then just aside on a legislative issue, I don't know if you've heard, but in the state Senate, which has a Democratic majority, is in a danger of falling below the 18 threshold temporarily, because Senator Lois Court is resigning for health reasons. And she will be replaced, I think, in pretty short order, but she hasn't resigned yet. And then Senator Pedersen is expecting a baby on January 30th, and she's going to take a whole month off when she has her baby.
She should
And this
take
is
3.
the first time that an active, a sitting legislator will have a baby when the session, legislators are in session. So maybe you could give some insight into helping to change the state rules, because right now
No babies.
she won't get her pay even for the month she takes off.
That's sad. And Governor Polis is still behind where Picken County is by only recommending 8 weeks leave.
Woo-hoo, Pitkin County.
Yeah.
Two things. One is on next Wednesday, I'm going to a legislative breakfast that CCI and CHSDA are having with legislators. So for me, it's sort of just a beginning introduction. I'll be looking for Carrie Donovan and Senator Donovan and McCluskey, but also I live in Garfield County, so I'll be looking for their representatives. But anyway, we do have an intention to stay much closer. And with that, the only thing that is missing for me in this process is how we keep updated on CCAT. Because we just need to make sure if and when we're ever in conflict with them. So.
Yeah, I mean, we could figure out logistics offline, but I would just note CCAT always holds a call prior to CCI, a call or a meeting prior to CCI, and there's an opportunity in between those that perhaps we can
talk.
touch
Okay.
base. Yeah.
Okay. Well, thank you for kicking the legislative season off with this presentation. I think it will be extremely helpful for all of us who are involved in these groups and that are working on legislation. So we look forward to continuing meeting, getting your updates and.
Great. We'll learn together.
Thanks. And I would just, sorry, the one thing I would just say, we'll try and get the monthly meetings to be somehow like the week of the CCI meetings so that we're all prepped, if that's kind of the best alignment.
Great, thank you.
Thank you.
Thanks.
So, next on the agenda, we have our future agendas, but I'm thinking that maybe we should have our presentation on the Whitewater Park first, because we have the people here for that. So Lisa, why don't you come up and do that next?
Right.
I didn't see this on my agenda.
It's a board open discussion.
Open discussion update.
Item that Lisa's going to.
Open discussion.
Yeah, it's an open
It's just
discussion
a
item.
quick update on that.
Yeah, just a quick update. We anticipate receiving our Army Corps permit today or tomorrow likely, and so we wanted to update the board just because you're going to see some construction down there, the mobilizing, and so in case the board had any, public questions or anything like that. I invited Quinn Donnelly with River Restoration, our river engineer, to kind of give you a brief update on the actual work that's happening down there, and then if the board has any questions, I thought I maybe briefed you everything, quickly last week, but I just wanted to come down and pop in and talk to you.
So did you say you're going to start work this week?
Well, we anticipate receiving the Army Corps permit this week.
Just a
That allows
permit,
us to,
But
yes.
not actually getting into the river?
No, probably, yeah.
Because we keep on seeing Pitkin
The ice
warnings
flows.
about ice flows.
Right. Yeah, and we've been monitoring that and letting our contractor know, so he's aware of all of that as well.
And he had an ice flow event during the original construction, so he's definitely, on the front of his brain too, as far as being ready for that. And the system he's setting up to isolate the channel is gonna be able to accommodate ice flow events.
Yep, thanks. So I'll just turn it over to Quinn, and he can give you a quick little update.
Yeah, well, thanks for having me down, Lisa. She asked me to just give you guys a quick update on what's going on there. And so, based on events that happened last summer and then feedback we got this fall, we had a pretty extensive public relations effort. We had a public meeting in October. We've met with the Healthy Rivers and Streams Board twice. We had a lot of conversations with and kind of the informal leaders in the Valley's river community, the fishing guys and the rafting guys and whatnot, to make sure we understood, what their concerns were. Moving forward, the focus is really on that high flow navigation, that really, as what happened last summer, there's just a little bit harder to get through those two features than we'd like it to be at high flows. And so in order to do that, we're going to do a couple things. We're going to basically add a similar sneak on River Right that's what's on River Left. And so they'll have two options to be able to get around the main hydraulic. As you guys know, the river kind of is curving from right to left, so that's kind of the general direction the boats are going to end up anyway. it's a much more involved process to put a ramp and a sneak there because of the pathway and the embankment and the road. And so that's why we didn't do that the first time around. We wanted to try to see if we could get something in there without doing a huge effort. And so that's going to allow basically kind of that flushing flow on the right side that we have on the left side now. We are going to adjust the kind of the invert, the crest of that upper feature. We're going to lower that to get that at high water, to get that feature to flush out more. Right now it kind of forms a hole and it's slowing boats down as they go through there, and then they have trouble maneuvering and getting through that lower feature. So that one will flush a lot more than it does now. And then we're going to be making modifications to the small grade controls that are below each feature. And that's really more, since we're going to be in there, some tweaks to the low flow recreation experience, as well to make some minor improvements to fish passage. As Lisa mentioned, we've been working with the Army Corps of Engineers and CPW the last couple months to make sure that they're on board with what we're doing. Sent one last email this morning, so we're hoping to get our permit issued either this afternoon or tomorrow. And so schedule-wise, the contractor's Digging It Riverworks, which is Brian Barrickman, the same guy who built it originally, so he's very familiar with the project, and we feel like he does a really good job, moving the boulders around, a very quality product. And so he's staging this week. We finished our coordination with the town of Basalt. The 404, the Army Corps permit's almost complete. It's basically just going to be a modification to the permit that we already have for the project, because it's good through 2021. So they just have to go through this somewhat informal review process. Because it's a more extensive work, we're going to be utilizing a bypass channel, kind of like we did with the original construction. So, we'll divert the flows around the main site through that kind of gravel bar on river left. And he'll use that material to build his cofferdam, and it'll go right back where he got it from. The in-water work needs to be done by March 15th, so he'll basically be working in the river probably starting early next week through the middle of March, and that date is in there because of the rainbow spawning season starts around then, so that's typically kind of the end of your in-water work window for winter. And then we're hoping the project will be complete and totally put back together and the disturbed areas restored by April 30th. The area where he's going to put the bypass channel, all the willows and cottonwoods will be, removed and then stored with their roots wet, and then we put back in place. So, because it really has established well, and I don't think it'll take that long to recover from this. The schedule I gave you is definitely river flow and weather dependent. If there's an ice flow event, sometimes that can slow things down, but we feel like he's got adequate time to do what we're asking him to do. And then, after the project is complete, we'll continue to monitor the project. As part of the Army Corps permit, we're, monitoring it every year for the next couple of years, so we'll continue to do that. So I guess I know that was a lot to kind of go over quickly, but you guys have any specific questions that I can answer?
George?
I forget, I was sort of following this for a while in the papers anyway, and it seemed like some of the comments I was reading it was less of a concern about having to have another sneak versus just fixing the makeup of that hole in terms of not flushing people through. So it sounds like you're going to be addressing both of them.
Yes, definitely. So particularly on the upper feature, we're going to add basically a sneak, but it's just going to minimize that hydraulic to just the center of the channel. And then we are at higher flows, it's going to be flushing a lot more. The lower feature just works so well at low flows as far as a recreational component. We're just going to focus there on making sure there's a pathway around the hydraulic in the middle. It'll still be one at high flows, but it'll be much easier to get around it than it was this last year.
All right, thanks.
All right.
You'll see staging we'll be at Fisherman's Park, we'll also be at the top of the access, and then on Basalt's Lot K over at the end of Emma Road, behind our old offices there. The cat will be staged out there. Big heavy equipment, some other equipment at Fisherman's Park, and then at the top of the access, they're gonna have a trailer there so they can walk down that path. We're gonna close everything off to the public so they can't be in there with the heavy equipment moving around.
And then the video that.
Yeah, and Matt Annabelle, we've hired Matt Annabelle back, and he's doing some informational videos. They just wrapped up a video with Pat this past week, and so we're going to put that out on, Pat probably put it out on social media already today. So we're doing all of that. We're getting in the paper, working with the chief of police on moving the heavy equipment, the fire department. Everyone's aware of what's happening out there.
Will there be a sign up for pedestrians who come by and see all the disruption? There'll
Yep.
be something explaining
Everything's
what's going
closed,
on?
yep.
Is your
Mhm.
pull the mic closer, maybe?
Oh, sorry. It's my fault.
Yeah, sorry.
Yeah, signage.
My question has to do with, how's this being paid for?
Out of the Healthy Rivers Fund. Yep, it's been budgeted for the last couple of years. So we didn't do any work last year, and so we rolled the funding into this year, and the board approved that during our budget process.
Okay, well, that's what I thought, but I
Yep.
just wanted to clarify.
Yeah.
Okay,
Great.
all right.
Looking forward to it.
Great.
Thanks, everybody.
Thanks for letting us come down.
Well, we hope this one takes and we get the
Right.
final solution
Yep.
this time.
Definitely.
Got it. Thank you.
Okay, John, let's go back and do the future agendas, and then we could do the, take up the draft agenda for the board retreat after that.
Okay. I'll actually wrap my two together because the only update right now I have for you on future agendas is about the board retreat. Unfortunately, we thought we had the Cato room booked, which is the one that you normally use upstairs. Turns out it was unavailable, so we've reserved the Kaufman room in the same building. It's a little bit larger room downstairs, still has kind of balcony windows. We'll have a little bit different feel to it. A little bit more space in case you need to have a food fight or something. So. That's really all I had outside of going over the draft board retreat based on our the draft agenda for the board retreat. But maybe
George has
John, I got a question. Wednesday, January 22, you have a possible recognition proclamation honoring Sheriff DeSalvo. What is that all about?
I did not put that on there, so I'm going to need to look at that. I do not know. I think I saw an email though, George, that there was. I don't know if it's a proclamation so much as there was an award given to the sheriff and mayor recognition of that. So I know we've had various requests for proclamations and such.
Yeah, it didn't make sense to me.
So I'll take a look, see at that.
Yeah, I noticed that too, wondered about that. Does any other board member have any future agenda items?
Mine only just came up, just covers the important topic of the menu at the board retreat. I know we're moving toward vegetarian options, lower carbon emissions options. If I see roast beef or something there, I'll be disappointed, but I don't know how others will respond.
I won't be.
He won't be. Well, see, I knew we've
So
got
this
it.
is my dilemma.
Right, there you go.
We should have a blend.
It's the only beef he eats that day. It's just, then I'll give him a pass.
It's like I have a donut once a month at RAFTA. And anyway, I think we start dealing with dietary needs, unless someone has a specific dietary need that needs to be addressed, it should be a combination too.
I'm all for a combination, just thinking it's a matter of awareness, that's it. It seems like, I seem to be going to a lot of public meetings with, really good beef selections lately, and I'm trying to
We
understand.
had chicken today
That's true.
and a veggie option, so it doesn't have to be beef, but that's nice to have an option, that's all.
No, I agree with that.
Yeah.
I'm actually not that strict with my own diet, just, I want other people to do it.
I mean, the best part of the retreat is always the food, so.
Well, that's true, that's true.
No offense, John, but.
Well, like I said, we're getting you a professional this year. So.
No reflection on you. Just-
I know. Are you ready to go on to are there other?
I think that's all. I don't have any.
I'm sorry, one other open discussion. I just want to follow up something that Greg has brought up a couple times in terms of the signages on Highway 82 when he asked you to contact our commissioner. What's the status on that?
Yeah, and actually, so I did send a pretty lengthy email. I think I copied the board on it to our CDOT commissioner. I think that is an email that wasn't working for Kathy. Apparently, she had not received it. but we did forward it on to our regional folks at CDOT. They gave us a fairly brief answer to, I think, an extensive set of questions. So we requested a more formal response and are still waiting for that.
Oh, if I could add on
And
to
I,
that.
I would add, I do think at least one member of the press has picked up on that email.
I wanted to point out that I think at least one sign doesn't seem to be there any longer. Something, some of the signs may have already disappeared. I'm not sure how or who, but I looked for one the other day and it wasn't there.
CDOT did offer the option if we wanted to take the sponsorship position of the company, that they would look at relocating them on other highway sections. But we would have to absorb that cost. And before bringing that option forward, I wanted a more formal response to the questions that we
So
asked.
is that, we'd have to pay CDOT to take the sign away? Is that the gist of that?
Basically, we would take over the sponsorship of that portion of the highway that pays for the cleanup, and then you guys would have the option whether you wanted a sign that said this is done by Picken County or not.
Interesting, okay.
So more to
Hear
come
more,
on that, George. I think it's important we get a more formalized response to what I thought were significant questions we raised before we considered options.
All right, thank you.
I was thinking on that we should maybe take it to our legislators just to make them aware of, we have this issue, we might call on them to help come up with a solution. If CDOT is doing this as a fundraising mechanism to have a billboard system across the state highways that look ugly to help fund the highways, I think there's better solutions for how to do fundraising for the CDOT than doing that.
Well, I will definitely bring that formal response. I think also being sure our attorney's office is aware of that from CDOT, and bring what options we see, and then if there's political options that the board wants to pursue, you can definitely give direction on that.
Mm-hmm. Okay.
Thanks for the reminder.
So, do you have the draft agenda for the retreat?
Thank you.
So this is obviously still very, very much a draft. It's a work in progress, but I think I want to be sure that it's following the general themes that the board talked about. So it's a two-sided print, so you have day one and day two. Day one really starts off with, just there's a continental breakfast, welcome and overview, board perspectives on 2019. So starting our day with looking back on the year since our last retreat, what went well, what was exciting, what would we change if we could, kind of conversation. That will then transition into, and we'll still be putting a finer point on these exercises, but we'll be getting this out to you ahead of the retreat, but really thinking about from the perspective of your legacy, what would you want an article in the paper to say about your time in office, about what the county accomplished, about what efforts you led, and what would you want that legacy to be, as a way for each of you to understand what each other's kind of major priorities are. A break and then a pivot to an update, kind of what is our status today? What are we working on? What are some of the big initiatives out of the day-to-day, outside of our day-to-day jobs that are absorbing time and resources? And this is really to kind of tee up, are we aligned? Are there some gaps that we need to talk about the next day? Lunch, give you guys a little bit of a break after that. And then we'd pivot to doing a panel on growth. We want to kind of tee that up in terms of putting context on growth in Pickens County, with Cindy providing just a brief history of growth management in Pickens County. So what our history has been with growth management, how we've defined and approached growth and growth management historically. The board then asked for a panel discussion. Right now we have one confirmed speaker. We do have Gabe Preston. We're working on a couple others based on the conversation that you guys had in our last work session. After the panel discussion, then we'd end the day with kind of a reflection of what we heard, and things like what surprised you, did anything make you uncomfortable, you know, what did you hear that you definitely want to be talking about again tomorrow. Really end day one that way. Day two is probably going to be a little bit more I guess, flexible in terms of where the conversation goes. The way we've structured day two now is to start off really trying to get a definition of when you think about growth, what is it we mean by that? You know, it's probably something different than just population growth, like might be reflected in the census numbers. So really getting our head around what is it, what are the impacts of it that we're concerned about, what are the impacts of it we're excited about, and such, as a way to kind of tee up a discussion about our emerging, you know, what is this board's emerging vision for how we want to deal with, what do we want our legacy, what do you want your legacy around growth to be in the future, and what are specific targets. We'd then get into a discussion of areas of, you know, what are areas of agreement or disagreement among the board members, what needs to either move forward or be reconciled in order to set some priorities for how we move forward. And then we want to kind of pivot to a conversation about, do we need to maybe make some updates both to our strategic plan and really big rock priorities moving forward. That's the alignment question, I think. I was talking to you about staff probably needing a little bit more direction and guidance on, make sure you guys are aligned as a body and make sure staff is aligned with those priorities. We'll look to close, we're not going to rewrite a strategic plan or such. It's more about identifying what would a process for that be and what are some high-level priorities that we need to be incorporating and working on. And we target ending by 3 o'clock. We generally reserve the room such that we can be flexible if the discussion requires that. Does that look like it reflects in broad terms what?
George?
So a couple of things. One is I remember Patty's comment in terms of the day after I leave office, rather than an individual, perhaps more of a board, broader collective perspective. And that would probably piggyback off of what we are proud of accomplishing. Something like that.
Yep.
I would agree with Patty's assessment on that, and especially given Kelly's only been here for a year. And then, you know, I
I think
mentioned
you
this.
put that on there because John asked me to do that last year, and I still have yet to do that for him.
I mentioned this to John, you know, when we, regarding our conversation about growth. And I was thinking that in Pickens County, even as today's paper showed, unincorporated Pickens County, which we're really responsible for, has done a tremendous job in terms of maintaining a very slow growth rate, 4% over 10 years. And so it seems like for us, the conversations we've had around growth is what are the impacts that we have to deal with because of the growth, whether it be in Aspen or Snowmass or even down Valley, that we don't have any control over land use policies. What are those impacts, and how are we going to try to resolve those impacts through some sort of funding mechanism? So whether it be child care or environment or public safety, transportation. I mean, for me, the growth means we've got impacts. So how do we deal with those impacts, and what are those mechanisms that we have? And so for me, that becomes a little more meaningful than just trying to address growth, because I think through ComDev's staff and the attorney's office, the county's done a tremendous job in terms of controlling growth rate.
And George, I had anticipated, thank you for bringing that up, because I had anticipated that would probably emerge in our discussion, kind of that 10:45 to 12:15 kind of slot in terms of what are some of the strategies for dealing with. We didn't want to prescribe too much what those impacts would be. We will have a very high level, it's not specific, but the FAB has been meeting on our budget and revenue questions, and they'll have some, I would say, high level kind of recommendations or targets around where they see the revenue priorities being in different areas too.
Because in the past, when we talked about other issues, we talked about where our spheres of influence is, right?
Mm-hmm.
Where do we actually have the ability to make a change, and where do we not, even though we're still impacted by that?
Yeah.
Yeah.
Okay, any other board comments on this today?
Yeah, I
Kelly?
guess just a little bit of reaction to George's comments is, you know, one of the things that I lack clarity on is where this board sort of stands on regionalism, you know, and if addressing some of these impacts, you know, where we say, yes, a regional approach is appropriate here and not appropriate here. And maybe that's obvious to other people and just not so obvious to me. But, you know, I don't know if that plays into this conversation.
Well, so I think you guys need to have a conversation about what you mean by growth, because that could be jobs. It could be the intensity of use of our infrastructure that's developed over the years, and you know how many people are in the community at one time, and then what does it take to support that level of people. And Kelly, what I see there is that leads into the types of discussions you're talking about. Well, where is that workforce? What is our responsibility? You know, is that growth? And we need some guidance on what your strategies are. Are you trying to manage and limit that type of growth? Are you trying to mitigate the impacts of that growth? Are you trying to provide supports to both the workforce and our residents? Because if so, it changes that concept of regionalism, but I think we need to define what it is that we keep saying growth is important, and I think it is, and I think that we keep hearing it in the community. It's not very particular or discrete in terms of what does that mean? What is it we're really worried about? And I think we need to answer that before we can answer, okay, these are the segments where we're feeling growth and that are causing impacts that we have influence over, to George's point, and that we need to take a different course on. Because it's pretty high level still. But I think it's really difficult to have that discussion if you want to focus it around growth until you know what it is,
Sure.
who it is, and what kind of impacts and issues we want to manage out of it. So that's kind of what we were thinking when we structured the agenda.
We're going to start at
It's a
50,000
lot.
feet.
It is, yeah, it's a pretty high level view, and then trying to find areas that we want to drill down on.
You know, what I'd love to add to this, an agenda like this, is something we've talked about after many of our longer meetings or tougher meetings, is that, you know, there was a tradition to go have a beer. Ely always talks about how, you know, after a tough meeting, everyone goes out for a beer.
Mm-hmm.
I'd love to have an informal, open to anyone, you know, a drink at the Aspen Meadows at the end of each day or at the end of the second day or whatever people think is appropriate.
During the retreat. you mean.
During the retreat, you know, you go through a day of retreat, maybe it's time to decompress and be informal and have a beer at the end of it. And I could probably do that
Have
2
a
days
bar.
in a row. I could make that sacrifice.
I don't know if we have to have that on the agenda, but it sounds like.
Well,
a good-
only if we want, you
Sounds
know,
like a good
if-
idea.
open to the public maybe is what it would have to be, which is
Yeah.
fine, whoever wants, but we're not buying necessarily, but if somebody's feeling really flush. Just a
I
thought.
think we can informally make that happen.
Okay, that's, 'cause there's always that, you know, you come out of a really high pressure meeting and you want to decompress, and often some of the ideas start flowing after the first sip.
All right.
And
Well,
not
maybe,
until
maybe
then.
we should have the beer first.
Well, that
So
too. We
the
could
ideas will
spike the
flow
coffee.
earlier than later.
We could have coffee drinks.
Mimosas for breakfast.
Mimosas, yeah.
We need to schedule nap time.
And then there'll be nap, yeah, midday nap.
So it sounds like with some adjustments and then some attention during the facilitation discussion, and to that point on the second day, that is pretty wide open. We're kind of counting on your guys' discussion and questions to help focus us on issues and such. And so that one's probably less directed except by where your conversation goes.
Okay.
Great.
All right, well,
I
if
think
this
it
is
looks good.
generally okay, we'll keep refining it and move forward.
Thank you.
Yeah, no, I think it looks good. Thank you.
So, this discussion's probably a good segue into our discussion on growth management. However, I think we need a 5-minute break because we've had a long day already, and so
Yeah, I agree with that, but 2 points. We have to call a special meeting.
Yeah.
And then I wonder whether we should go into exec first, right after the special meeting. If so, then we can let grassroots go for a while. I think at some point we need an exec meeting for this discussion.
Yeah, that's why we are calling a special meeting for this next item, because we're planning on having an executive session as part of it.
Right, so my question is, when are we gonna have that exec? At the very onset?
No, I think it would be later on in the discussion is what I discussed with Rich and John yesterday.
Okay.
But,
Yes, I'd also look to John Ely, though, if there's a preference from the attorney's perspective, we may want to hear that first.
yeah, what is your preference?
Boy, you really can't see these things when you're over here. Well, to discuss particular methods or approaches to problem solving, that necessarily involves some degree of legal advice, but to try to outline the problem or try to focus the discussion a little bit more. That is more of a policy discussion that can happen in an open meeting format if that's acceptable to the board, or if, you know, I mean, it really is your decision. If you feel that your issues are going to or your discussion is going to overlap to such a degree that it's hard to move it forward without having a more back and forth with legal advice interwoven with a discussion of different methodologies or approaches to the issue, the problems, the potential code amendments, et cetera. I mean, go into it right off the bat. I guess it's more of a topic for you guys as to how you envision the discussion evolving.
Well, my feeling is that as we have the discussion with the staff from ComDev about the growth management system, that then questions may or may not arise where we would feel like we'd want to have more advice on it. And it could well be advice that could be just public information too. Or it could be something where we'll come up with a list of things that we would want your office to weigh in on, but perhaps have to do a little more research on it.
I do know there's just one member of the public here for this particular item, who was a representative of one of the two applicants that were tabled at the last regular meeting.
Mm-hmm.
I mean, for me, it's hard to start a discussion, and if we have some questions or in areas that perhaps we may need to go in exec, we may be jumping back and forth, frankly, rather than at least getting an overview in terms of, from the attorney's office, what some of the issues are that we should be thinking about and perhaps not wanting to discuss in public.
Mm-hmm.
Well, then it sounds like it would be an easier discussion to go into the exec session.
Do the
initially.
exec session first, and then, but that would give the grassroots person a little bit of a break until we come back into our main discussion then with on the growth management.
Sounds good.
So I'll call a special meeting right now and would entertain a motion to go into executive session for purposes of what, John?
Steve, Steve, that would be for purposes of discussion with council regarding the growth management quota system code amendments or potential code amendments and any issues regarding moratoria. There is a second issue that involves a discussion concerning APSHA enforcement action. Both of those, well, the first section would be pursuant to CRS 24.6.4024B, and the second would be pursuant to CRS 24.6.4024E.
Is that it? So moved.
Okay, do we have a second?
We have a second, just a question. So since we've got a member from the public here and staff for GMQS, we can have an exec on that, come back and have that discussion, and then we can go back into exec for an APSHA?
Yes, we can certainly go in and out of the discussion. In fact, if you want to wait before you go into an exec, you can at least entertain comments from the member of the public who's here. I'm fully assuming that the two staff people, still two present, will be in the exec session with us.
We have to convene special meeting first, don't we?
Steve called it.
Yeah, I called the special meeting. We could hear public comment if, it depends on what the member of the public is here just to listen to our discussion or actually has comments to make, and maybe he needs to listen to our discussion before having his input. So I guess I could put that question to you, sir, if you have a time frame where you need to be leaving, or if you don't mind waiting while we do our executive session to learn about the legalities of our discussion on the GMQS.
Sure.
Could you come up to a mic, please?
You bet.
And then identify yourself for the record.
My name is Bart Johnson. I'm here on behalf of one of the applicants from the continued GMQS decision a week ago. First of all, Suzanne was kind enough to let me know she could just text me when you come out of executive session. My office is a block away, so that's easy enough. But I'll say that I'm mainly here just to listen, and I support the idea from a policy perspective of looking at GMQS and how the system works or doesn't work. I think most anybody who participates in the system would agree that it is a little rough around the edges and probably needs a re-examination. But as far as my client's concerned, my main objective is to kind of listen and frankly make sure that your policy discussion doesn't stray into a specific discussion of their particular application and how it might be derailed or treated differently than it should have been. So I'm in favor of the policy discussion. I just want to make sure we don't end up with a discussion kind of out of order on the particular application. So that's my 2 cents.
Okay.
That helps. Thanks.
So it sounds like in that case, we should go into executive session right now. And then Suzanne, you could let Bart know when we come out of executive session. So further thoughts from the board? Does that sound good? So all in favor of the going into executive session now, say aye.
Aye.
Aye. Okay.
Are we going upstairs?
We'll go upstairs.
Take a break on the way.
There was a motion and second. Can't remember.
Upstairs or?
Motion, second.
I
Probably
think
upstairs.
yeah.
Safe.